This is Garrett Mulcahy reporting to you tonight about a serious case of stem cell fraud in Denver, Colorado. This week, our investigative team took a look at Denver Regenerative Medicine, whose website claims that with a concoction of plasma, platelet, and adipose-derived stem cells, they can treat a whole host of diseases, including joint injuries, COPD, erectile dysfunction, multiple sclerosis, type 2 diabetes, Parkinson's disease, lupus, rheumatoid arthritis, osteoarthritis, fibromyalgia, and hair loss. At the same time, they claim that the risks are minimal, stating, quote, "We use your own cells, so there's very little chance of systemic rejection." For a more thorough investigation of what we found on Denver Regenerative Medicine, we turn to primary investigator Maya Black.
Visitors to DRM's website are greeted with a beautifully designed website that advertises several treatments. They boast about being BBB accredited, but they say nothing about FDA approval. They provide a scientific-seeming FAQ and blog, which, while giving technically correct information, is overly simplistic and encourages skepticism of regulation of stem cell therapies. In addition, they give links to clinical research that is supposed to support their work, but the articles are either difficult or impossible to access and are not pertinent in some cases to the procedures being described. The website also relies on a large section of dramatic video and word testimonials. To top it off, they provide a testimony from former Denver Bronco Mike Schlereth. Here's what the football superstar has to say about DRM.
Hi, I'm Mark Schlereth, Super Bowl champion and former Denver Bronco. Playing football for most of my life took its toll on my body. I've had too many surgeries to count, so I went to Denver Regenerative Medicine to see if they could fix my shoulders, which have had extensive tendon tears and arthritis. They were able to combine my own stem cells and platelets and inject the combination directly into the damaged areas. The procedure only took an hour and a half, and I began to feel significantly better after only the first week. Now I'm 8 weeks out, and my shoulders haven't felt this good in more than a decade. I wish I had this procedure 10 years ago. Before you have surgery, talk to these guys.
Other dramatic testimonials are included that contain miraculous, almost instantaneous improvement that allowed patients to gain their lives back.
It was painless, it was simple, and I got up and totally walked out with no pain in my knee.
Oh, it's a whole life difference.
Would you recommend stem cell therapy to somebody else with rheumatoid arthritis?
Absolutely.
One woman even shares that she was able to walk down a flight of stairs at her wedding. To the untrained eye, these stories seem credible. After all, who wouldn't want to believe that those at DRM just want to help? However, these stories are too miraculous. These stories are often from recruiter patients. Recruiter patients are patients who are given a discount on their procedure in order to provide great feedback to recruit other patients. Overall, this earns the clinic more money. Most importantly, DRM's practices are illegal. The procedure being described should be regulated as an FDA biological drug or a 351. A 351 is described as a biological product such as a virus, therapeutic serum, toxin, antitoxin, vaccine, blood component or derivative, allergenic product, or analogous product applicable to the prevention, treatment, or cure of a disease or condition of human beings. All 351 products require FDA approval after vigorous rounds of clinical testing. Currently, the only FDA-approved stem cell therapy is a bone marrow transplant. The process that makes this stem cell therapy a 351 is stromal vascular fraction, or SVF. On the website, they detail that they take fat tissue from the patient through liposuction. They then spin down the fat tissue and remove the stem cell portion. This portion is then reinserted into the damaged area. In addition, there is contradictory evidence online of where they actually obtain the stem cells. On some pages, they say that the stem cells are obtained from fat tissue. However, on other pages, they mention that the stem cells are obtained from bone marrow. Even if the stem cells were obtained from bone marrow, it's still an illegal procedure because the stem cells are being used non-homologously, meaning that they are being reinserted into a different place from where they were taken. More importantly, you are paying extremely large amounts of money for a treatment with no scientific backing. They aggressively market the cost of their treatment, saying that they will meet the price of their competitors, and that they even provide interest-free payment options. We asked them how much we could expect the cost of treatment to be whenever we called them, and they gave us a quote of at least $4,500 to $6,500.
Okay, so we have Detective Wyatt Montgomery calling Denver Regenerative Medicine. at 720-583-1648.
Hello, this is Carl Jones. I was calling to inquire about your erectile dysfunction stem cell treatment.
Sure, what can I answer for you?
What is the procedure like for this? I'm sorry.
Alright, so she is not available, but I know a lot about it, so let me just tell you what I do know. So stem cells, basically they have a lot of growth factors in them, all the good stuff. So basically what happened is we would go in and we would do a mini liposuction and get the stem cells from the adipose fat in your abdomen. We would then take that and spin it down with PRP, platelet-rich plasma that we do from a blood draw. Basically just taking out the red blood cells, taking all the good stuff, kind of gives the stem cells like kick in the butt and get them going. And then after that, it would be injected directly to the penis, and that would help to restore blood flow, help regenerate any, damaged tissue, stuff like that, to increase function. But usually you would be able to start seeing results within a couple months. He might ask you, to hold back from having sex just for a little while. But that, again, it's different for every single person depending on your age and multiple different factors. So that would be something you'd have to ask him.
And you mentioned the doctor. Is there multiple doctors, or is one doctor?
Nope. So we have one doctor. His name is Dr. Julian Gershon. If you look him up in Google, he has a clinic up in Aspen as well. So that is the same guy that we have here. And he has certified in everything in regenerative medicine as well as hormone replacement therapy, all kinds of anti-aging medicine. He's triple board certified.
And I couldn't find on the website how much this costs.
It may be around $6,500 to $7,500. That's usually where it'd be right around. But that.
Are there follow-ups or?
Absolutely, yeah. So the good news is he would be awake. It's not a surgery. It's more of a procedure. It's something that works very well. He's had a lot of success with it. He would see you afterwards for several follow-ups to make sure that you were getting the results that you wanted.
There are two main doctors currently associated with Denver Regenerative Medicine, Dr. Joel Cherdak and Dr. Julian Gershon. Dr. Joel Cherdak is the founder of DRM. He has a doctorate in chiropractic, however he is not a medical doctor such as an MD or DO. He describes himself as a ringleader for a pain management and rehabilitation clinic in one of his interview videos with a news station. Because he is not a medical doctor, he cannot prescribe medication, as he is only a chiropractor, so he knew he had to have a partner somewhere. This partner is Dr. Julian Gershon. Gershon recently partnered with the practice from his own practice in Aspen, Colorado. He is a DO and is triple board certified in family medicine, sports medicine, and anti-aging and regenerative medicine. To ensure that these were legitimate board certifications, we first looked up all of the American Medical Association's AMA and American Board of Medical Specialties, ABMS, accredited medical boards. There is no recognized board for anti-aging and regenerative medicine. We then searched online using certificationmatters.org to check that he was truly board certified in the other two fields. Certificationmatters.org is a website that pulls information from all 24 AMA and ABMS accredited medical boards. We typed in his name and nothing came up in the results. This means that Gershon either was never board certified or he is not currently board certified. While there may be other, more unofficial licensing boards, these are the most legitimate boards available, so we chose to search through these.
In conclusion, we would recommend that you look at alternatives if you are considering a stem cell treatment. Interested patients must remember that stem cell treatments are still very primitive and in developmental phases. If you are interested in trying a stem cell treatment, we encourage you to go to ClinicalTrials.gov and find an FDA-approved trial. Ensure that the trial is actually FDA-approved, as not all trials listed on the website are. FDA-approved trials typically come at no cost to the patient. Some might even pay you. Most trials take place at an academically affiliated hospital or institution, not local clinics. So although you may have to travel for a trial, it's worth it. In addition, all FDA-approved trials must have some scientific research supporting them, ensuring that the treatment is more likely to work than those you'd find at a for-profit clinic, such as Denver Regenerative Medicine.